Alright guys, our patient's showing symptoms of endocarditis, endothelitis, and sinusitis.
Based on that, I believe it could be a case of acute myocardial infarction. The endocarditis is the giveaway there, Hawks.
I'm inclined to agree with Leslie. The endothelitis is also consistent with AMI.
You might have something there, guys. But I still think we should consider it being a case of gout. Sinusitis and endothelitis are common in that condition.
Hang on to your hats, fools. It's definitely progressive bifocal chorioretinal atrophy.
But Hawks, your diagnosis doesn't take into account the endocarditis or endothelitis. Those symptoms seem to point more towards AMI or gout than PBTA.
Right. If it was just sinusitis and endothelitis, then maybe. But with the endocarditis, I don't see how it couldn't be at least one of those two things.
I don't have a hat to hang on to.
Then get one after work, Caillou.
Hawks, I've called you into my office because I need to discuss your proposed decompression surgery on a patient with progressive bifocal chorioretinal atrophy.
What's there to discuss? I'm the best surgeon in this hospital. You don't question me when it comes to surgical decisions. I have years of experience. I know what I'm doing.
You're not a surgeon, you're a diagnostician.
Okay, but I did have to diagnose the patient with a surgery, therefore I'm the most qualified to perform it.
That's like walking into a Japanese steakhouse and telling them, hey guys, I do amateur barbecue in my kitchen on Thursday nights. We're so totally alike.
I've used that one before.
How did they respond?
I'm not sure. They really didn't like it when I told them that anyone can pull a plastic pair of pants down to simulate pissing on a grill. It doesn't take 10 years to master that technique unless they're homeschooled.
I don't even know what you're talking about. None of this is medically relevant. Get out!
So, it seems like decompression was not the best course of action after all.
Dr. Hawks really had us believing that was the way to go, but I think we can do better.
I didn't believe him at all. Yet here we are. What could be a better treatment for progressive bifocal chorioretinal atrophy?
Well, my wild idea is to try out some experimental therapy they've been talking about in recent studies. It might just work wonders.
What does it involve?
Something about taking the patient to a veterinarian and asking them for drugs we don't have in the hospital.
Yeah, that would go great, I'm sure, Frank.
You idiots nearly killed our patient. You're supposed to be top diagnostic doctors, but you screw up progressive bifocal chorioretinal atrophy. What the shit was that?
But Hawks, we thought.
You thought incorrectly?
The decompression surgery was a good treatment for it.
We weren't sure. We made an educated guess.
Guess? You guessed wrong. I should kicked your asses when you started this crap. What were you thinking?
I was wondering what kind of hat would look good on me while in the hospital.
Want a suggestion? Get a hat that points down and says, "Don't talk to me, I'm stupid. I'm getting lunch." Well, I must say, it seems like your oncology department is doing quite well.
Thank you, Hawks. Our team has been working hard to ensure our patients receive the best possible care.
Didn't ask. But anyway, how is the perplexing medical case going?
It's challenging, but we're making progress. What about your own case, Hawks?
Yes. Well, I think I've finally figured it out.
Figured out what, exactly?
What's wrong with my patient? It was a complex diagnosis, but I managed to solve it. I know you're all mad at me for not having proper protective equipment on, but trust me, what I've discovered here could change everything.
And just how are we supposed to trust you when you're putting yourself and us in danger?
I have to agree with Leslie, this is just reckless behavior, Hawks. We can't have you jeopardizing our safety like that.
Look, I understand your excitement, but there's a time and place for everything. Right now, isn't it?
Progressive bifocal chorioretinal atrophy was wrong. Telizaius-Merzbacher disease is the real diagnosis here.
How do we know this isn't another wild goose chase for you?
And what about the prognosis? What's your take on that?
The prognosis is grim. The patient has less than a year to live.
That's quite a prognosis, Hawks. We'll have to get working quickly then.
Work quickly on what? Funeral arrangements? That's what next of kin is for. On to the next patient, please. I'm sorry, but you should be more careful with your words, Tracy.
Why are you apologizing? You're the one who made a mistake in diagnosing Telizaius-Merzbacher disease instead of progressive bifocal chorioretinal atrophy.
I'm not apologizing. I'm just suggesting you watch your tone against an expert diagnostician here.
You claimed you were a qualified surgeon earlier today.
Yeah, but in reality, I came here to diagnose patients, not perform surgeries.
Oh, so now you agree with me.
No, I think we just came to a similar understanding of what's expected of me and my duties with different interpretations. Good night.